Hi everyone. This is not going to be a very long video. I will talk about permanent fillers. Everyone's dream, to have a permanent filler once and for all. Well, patients, particularly for the lips, request a permanent filler, or for the cheekbones. It's a nice dream, but please know that it's not possible. A permanent filler that does not cause any problems has not yet been produced and will not be produced. Why? Because this is not natural. If you are doing something, it should be as natural as possible, nature-friendly. There is nothing permanent in our bodies. All tissues are gradually destroyed and replaced. So are the cells. Aged cells die, are eliminated from the body and replaced. This is the case for all tissues. It's the same for the liver, the bones, the blood vessels, the blood cells, everything. There are few things in the body that do not change. One example is nerve cells. They are neither replaced nor repaired in many parts of the body. The number of nerve cells remains constant throughout life. Well, patients want to have a lip augmentation once and for all. Don't demand that, because it cannot happen. Why do I say that? The human being, with all of her or his tissues, is a constantly renewed organism. All tissues gradually age, die, to be discarded and replaced. Take bone tissue. Everyone thinks that bone tissue is solid, like stone. That's not the case. Bone is, in fact, a soft tissue undergoing constant change. Let me give you an example. There is this wrong idea. Let's say I will place a prosthesis on the chin. I perform chin augmentation with a silicone prosthesis. The patient says, I don't want silicone there. Why? He believes that the silicone melts down the bone. Look, this is an urban myth. Silicone melting the bone. Oh dear. Let me tell you the truth. This idea is completely wrong. When you place silicone prostheses on the chin, over the years, it actually gets embedded within the bone by 1 to 2 millimeters. It nests in there. Not because it melts the bone, but because bone tissue is a living, soft tissue. Aging cells in the bone tissue are gradually excreted and replaced. They are constantly renewed, and the silicone implant placed may get embedded a little. This is a normal outcome. This does not mean that silicone melts the bone. Simply put, the bone is renewed. Plus, it has an advantage. The silicone prosthesis fits better when it is embedded in the bone. It becomes firm in its place, does not move left or right. The risk of moving or coming off is reduced. Patients think that bone is something solid like a stone. That's not true. If, for example, you were to keep someone's arm bent in a weird position over the years, that bone would gradually bend. For example, let me talk about an ancient Chinese custom. They used to tightly wrap young girls' feet. Why did they do that? They wanted to keep the foot size small. The foot bones of these people were deformed. The foot remained small, did not grow. The bones bent, converged, and eventually deformed. Because bone does not consist of hard tissue like steel. It is alive and it is soft. So even bone is constantly renewed, transformed. Therefore, no permanent filler can be beneficial for your body. Permanent filling will definitely cause problems over the years. It's been tried many times over the years. A permanent injectable filler comes to the market. Well, it is widely used. It becomes all the rage. Then complications arise. The product is criticized and it recalled from the market. After a while, another product is introduced. They might call it improved, advanced. It is used. It becomes a trend. But then complications arise once again and it is also recalled. Well, I have seen 3 or 4 such products over the last 20 years. They were promoted as permanent fillers, were widely used at first, but complications arose and they were recalled, then another was launched and disappeared. First of all, it is against the laws of nature. The nature of the body is designed to be renewed. The filler you apply has to dissolve. It's natural. Because all body cells age and are replenished over time. A permanent filler is no good for your body. Second, such a filling may cause allergies and reactions. Because an insoluble substance is 99.9%, it has synthetic ingredients. You will not be able to remove it if it causes any allergies or a bad reaction. It is injected and diffuses inside. This was the problem with liquid silicone, which was widely used years ago. Liquid silicone was used, then what happened? It caused granulomas, painful masses, inflammation among patients. What happened to it? It was not possible to remove them. We couldn't remove the silicone since it dissolved inside. I'm talking about liquid silicone. Don't confuse it with the silicone prostheses used today. What I'm talking about is liquid silicone. You inject it inside. It is a banned product right now. As far as I know, it is produced in Mexico and sold under the brand name Biopolymero. It is still available in the market through illegal means. I hear there are still places in Istanbul applying it, but it is actually prohibited. Stay away from liquid silicone. It does not dissolve. It stays in your body for life, yes, but it will cause trouble for life. Take hyaluronic acid. I may suggest a hyaluronic acid injection for the lips. The patient says, but it will dissolve. Sure it will. It has to dissolve. Because all tissues in the body dissolve over time and are renewed. We don't have any permanent tissues. By the way, let me point out something else. I want to note something. The other day, a patient of mine called saying I had performed a rhinoplasty on her 20 years ago. She wanted a revision. Imagine, 20 years. Well, if your nose has changed after 20 years, this cannot be attributed to nose surgery. You have simply aged. It has been 20 years. Imagine that. Children born when I performed that surgery are now 20 years old. For some reason, the patient does not take into account aging. She just says, I need a revision. Well, I quit performing rhinoplasty 11 years ago. I haven't performed it for 11 years. Look, just don't forget, humans get older. In other words, whether you receive a filler or undergo an operation, the result will not be permanent. Don't expect it to stay the same for life. Don't dream of such things. Plastic interventions on some organs may require revision. For example, breasts, breast surgery. The breast tissue has a lot of disadvantages because it is a massive, soft texture without any bone structure. It is exposed to gravity. So even if the patient does not undergo any operations, does not give birth, the breast may sag due to gravity. It is a tissue affected by hormones. The patient may become pregnant, can breastfeed, etc. Since it's a glandular tissue, there is a risk of atrophy. It can be hollowed out, and it sags further due to gravity. You end up with a hollow, saggy breast. Patients ask, will my breast sag if I get a prosthesis? I tell them, breast sag even when there is no prosthesis. Breast is a tissue exposed to gravity, affected by hormonal change. So, if you undergo breast surgery, do not expect permanent results for life. There is no such thing. Nothing is permanent. Well, there are some surgeries with permanent results, for sure. A diabetic patient may have his leg amputated, the result will be permanent. Or the removal of tonsils. If the tonsils are removed, the result is permanent. Do I make myself clear? 99% of plastic surgeries, however, do not yield permanent results. Therefore, don't expect results for life. The same goes for fillers. Think about it. You get old, dead tissues are removed, and all your tissues are renewed. So, it's the same with fillers because that's human nature. Do I make myself clear? That is, unnatural techniques going against the laws of nature always will create problems. Keep this in mind. Then let me make another note about silicone prostheses. We've talked about how prostheses inserted in the chin lodge in there. Silicone prostheses are synthetic, yes, but they are produced from a completely inert material. What does inert mean? It means that it will not cause a reaction in the body. When you insert a breast prosthesis, a silicone implant under the breast, it will not trigger a reaction. Therefore, it can be used with peace of mind. Okay? It is not soluble and it is not a very natural substance. Admittedly, it's a synthetic material, but a substance that has been proven not to cause a reaction. Therefore, silicone is a material that can be used in many places, not only in prostheses, but also in other medical fields. It is used in surgical instruments and as an ingredient in other implants. It is also used in disciplines other than plastic surgery, because silicone has been proven to be inert. It will not cause a reaction. So, it should not be confused with the fillers or the synthetic materials that cause reactions. Well, I think I can wrap up now. As I've said, always respect the nature. Nature tells us that fillings and injections applied to the body should be temporary. You should not expect them to be permanent. Okay, thank you for watching. See you on the next one.